This is the video for the pre-appointment pre-patient treatment infection control process evaluation. First, checks the water bottle fluid level, refills if necessary, adds blue tab to the bottle each time before filling, turns water switch on, removes rheostat and ultrasonic foot pedal, throwing away a paper towel from the top of patient chair and places them on the floor near the patient chair. Lowers patient chair and turns on master switch. Puts on mask and glasses, washes hands with using the antiseptic technique, takes 2 towels, dampens 1 paper towel, and places it on the bracket tray. Uses other paper towel to dry hands, then turn off faucet and put on gloves. So antiseptic wash will be 3 times for 30 seconds, and she's magically finished that.
Oh, I forgot to put gloves on.
Once you have the paper towel placed on the bracket tray, then you will don gloves. Uses damp paper towel from the bracket tray to dust the light shield, the lowered patient chair, and the operator chair in a top to bottom method. Flushes air water syringe line for 2 minutes at the start of clinic and 20 to 30 seconds between patients. It's the water line that must be flushed, so push the water button. And it's now been 2 minutes. Turning head to avoid splashing eyes, obtains 2 wipes, with 1 disinfectant wipe in each hand, and takes caution not to touch any clean surface with gloved hands. More than 2 wipes will be needed, as surfaces must stay wet 5 minutes. Carefully disinfects all surfaces, the lid of the wipe container, every time you take out wipes, the light handles and arms, the bracket tray and arms, view box, handpiece tubing, holders, and tubing, including the air water, taking care to wipe those lines all the way from one end to the other. the accessory arm, all its holders and tubings. Then obtains 2 new wipes. I forgot to mention to include the arms, the ultrasonic handle and tubing. But Ms. Martinez got it done. Then obtains your 2 new wipes to disinfect your bib clip, pens, rolling cart, sheet protector, which is utilized for the barrier technique, patient armrests, drawer handles, and countertops. The facilitator will wipe the contaminated bin. Obtains 2 new wipes, 1 in each hand, and carefully disinfects shoes, base of patient and operator chairs, base of operator chair, and adjustment levers, around the sink and inside of sink. Because that fell, she's getting some new, fresh, wet wipes, if needed, to re-disinfect that, making sure that you're still wearing all of your PPE and your gloves. Then wash or use sanitizing rub. She makes that look easy. Next, we're going to place barriers on all surfaces which may be contacted during clinic procedures. This would include patient chair, with a large bag, bracket tray, being careful not to let the bag touch the floor. The operator chair back. This will be with a smaller bag. And the accessory arm. Then the operator chair adjustment controls. Of which there are 3. Light switch, view box switch, identifies one half of the rolling cart as clean, which is the drawer side, and one half of the rolling cart is contaminated, which is the back. Wraps one set of pens and leaves one set unbarriered. Next, we're going to use the poly vinyl wrap to cover our ultrasonic. The same wrap will be used to cover the light handle and shield, taking care not to get any of the plastic on the glass portions or anywhere other than the straight face. A third poly wrap will be used to cover your computer screen. Next, we will barrier our air water syringe handle, our HVE or high volume evacuator, our saliva ejector tubing,
I'll fix this barrier when I put the air or the saliva ejector in the actual saliva ejector.
Perfect.
I
Then
left one more out for the hand piece that we don't have right now, so I'm just holding on to it until I get permission to open my hand piece.
perfect. Then obtain disposable intraoral supplies. Ms. Martinez, can you show them there were some questions on what a tray cover was. And so it's this piece of
paper is a tray cover, and it comes a little bit later in your PE when it talks about covering your instruments with the paper and the patient napkin. But honestly, if you're going to use this, it's a good time to get it out right now when you're doing your disposable supplies. And again, there's my cover for my handpiece, and I'm going to get those other supplies. And I'm going to go ahead and get the napkin and a cup because I know I'm going to need it later. I'm just going to put everything on this tray right now. Okay, you take the opportunity to put these saliva ejectors in. I'm going to take off the handle, or the cover, not the handle. Push that all the way down.
And there is a little slit cut in those that you can find to push that through, so you don't have to make a whole new hole.
Some of them you do, but a lot of times we help you out with that.
That's true.
And then when you put your HV in, we need to make sure that the notch of the HVE goes at the top.
Now you're ready to obtain your instruments. To do that, you must take your bagged instruments from sterilization, show them to your CI. Once you have approval that they are sterile, you can then open the instrument packet. You'll be sliding the instruments on top of the bracket tray without touching them with your naked hands. Then you'll take your cup and obtain the appropriate amount of antimicrobial mouth rinse for your patient. And will you show us just on the outside of the cup, Ms. Martinez, what that amount would be?
About right here.
There we go, and we can put it back.
And the mouth rinse is missing from back here, so we're going to pretend like there's mouth rinse in here, and I'm going to put it on the tray.
Then you're going to cover the bracket tray with the paper cover, with the patient napkin over the top, and bib clip until patient is seated. One thing that I must have left off was I didn't ask her to bring the patient eyewear.
Oh, patient eyewear, I'm sorry. This patient eyewear should also go on the bracket tray.
Perfect. And those will remain there until the patient is seated. Once the patient is seated, you'll take the napkin from the patient and place it on the patient, and instruct all adults to rinse with the antimicrobial mouth rinse for 30 seconds prior to intraoral procedures. Patients should then expectorate the rinse back into the cup. While the patient is swishing, you'll then put on your mask, eyewear, wash or sanitize your hands, and put on your gloves. Once this is completed, you can begin to arrange your instruments on your tray, including placing your air water syringe, tip.
So you would find the notch, and then put the air water syringe on and put it back down.
Then you'll suction the antimicrobial rinse with the saliva ejector out of the cup and return the cup to the tray for discarding debris. You'll then provide your patient with their protective eyewear. And remember that patient PPE does not leave the operatory. During treatment, you'll utilize the barrier technique for recording entries during intraoral procedures. Will you demonstrate what that would look like for them?
So I put the clean side on my patient's chart on the clean side, and I'll take my barrier pen that's dirty, and I will make sure that when I'm writing, my hand stays on the dirty side, and I'm on the clean chart, and I can actually go ahead and write. So then I can set my pen down and go back to something intraoral, and then if I need to write, when I'm done with my extraoral, I can come back and I can write on the chart, set it down, and roll back in here and do something else. so I don't have to keep taking my gloves on and off in order to access my patient's charts.
Perfect. You're going to also avoid direct gloved hand contact with contaminated surfaces, especially but not limited to your mask, eyewear, including your loops and light, hair, and the patient record. Keep the instruments as you're working clear of gross debris, keeping a neat and tidy tray throughout the appointment. You can use a damp 2x2 gauze to wipe the mirror face clean. And Ms. Martinez, what were you going to say there?
Sometimes we use the 2x2s or these cotton rolls to kind of roll our instruments on to keep them clean.
And then those can be placed in your discard cup. Remove and discard gloves, washes hands or uses sanitizing rub whenever you're going to access supplies in drawers or cupboards. When you leave the dental operatory, and after performing intraoral procedures and or handling the patient's permanent chart. Then rewash and or resanitize and place gloves when returning to the operatory if intraoral procedures are to be continued.
If they're not going to be continued, then I just wash my hands or sanitize, and I don't have to put gloves back on.
Perfect. During this time, you're going to look for anything that, if during treatment you've dropped anything, you're going to go ahead and sanitize as she just did, place gloves, and then pick up any instruments with gloved hands. And you'll place it in your contaminated bin with your instruments. Then you will deglove, wash or sanitize, and replace clean gloves before you return to the treatment area. And that concludes RPE.